Low hemoglobin concentration is associated with a high risk of hemorrhagic stroke in patients undergoing hemodialysis. Stroke is a major cause of death and disability in patients undergoing maintenance hemodialysis. Therefore, identifying the risk factors for stroke is required to improve the prognosis of patients undergoing HD. A recent trial has highlighted on the association of high hemoglobin concentrations and the incidence of stroke in the field of chronic kidney disease, CKD, including HD therapy. The goal of the study was to identify the relationship between the hemoglobin concentration and the risk of hemorrhagic or ischemic stroke in patients undergoing maintenance HD. Patients of age 18 or above who underwent hemodialysis were included in the study. The multicenter, prospective observational study included 3,436 patients. Hemoglobin concentration was measured, and its association with risk of stroke was analyzed. The primary outcomes were the incidence of first development of hemorrhagic or ischemic stroke. During the follow-up period, 2.2% of patients developed hemorrhagic stroke and 4.0% developed ischemic stroke. The patients with the lowest hemoglobin concentrations had a 2.31-fold higher risk of hemorrhagic stroke. The risk of having a hemorrhagic stroke increased as the hemoglobin levels decreased. The incidence rate of ischemic stroke did not differ by each quartile according to the hemoglobin concentration. Thus, the 4-year incidence rate of ischemic stroke and the hemoglobin concentration did not have any association. The study results show that low hemoglobin level indicates a high risk of hemorrhagic stroke, but no such relationship was identified for ischemic stroke in patients undergoing HD.